Hey, cheeky chatters. Dr. Amy here. This is our first live Q&A. I am going to come on weekly for a live Q&A where drop your questions below a couple days before I do it. If anything comes up, I'll answer those questions. But if you guys don't have any questions, then we'll be doing a weekly little pelvic health education during these live Q&As if there are no questions. For this Q&A, and these will be posted on the Cheeky Chat Facebook group, so you can always go back and go listen to an old one if you need to catch the replay, because I know Tuesday at noon isn't the best time for everybody to be able to hop on. We did get 4 questions for today's Cheeky Chat, but before we dive into those 4 questions that were submitted, I'm going to give you guys a little pelvic floor 101 just so that we have a good foundation as I get into answering the Q&A questions. As you can see, I love the word cheeky, so I keep saying it. Okay, so this is going to be a pretty basic overview about anatomy and function of your pelvic floor, but this is super duper important when it comes to understanding my answers to the questions that were submitted today. So this is what your pelvis looks like, and everybody has one. Men, women, children, we all got this guy here. When it comes to knowing about where your pelvic floor is, you have to understand the bony landmarks that your pelvic floor attaches to. So here you have the left side of your pelvis over here, and then the right side of your pelvis on the other side. And you can see that they are connected to each other here at the front at your pubic bone, and they're also connected on the back side where your sacrum or the base of your spine is. So if we had the rest of the skeleton, the spine would be going up and down from this middle part here, which we call sacrum. Now your pelvis also talks to your hip joints, and so you can see the hip joint here. And so your pelvis is the center of your whole body, and a lot of people can have issues in this area because there are a lot of muscles that cross here and a lot of joints too, and we're about to dive into that next. So major joints that you guys need to know is the pubic bone here. A lot of women during pregnancy and postpartum will have a lot of pubic symphysis pain. Sometimes they'll call it lightning crotch. On the back side, you have your SI joints. You have one on each side here. A lot of people struggle with SI joint pain, and I'll tell you that a lot of it can also come from your pelvic floor muscles because your pelvic floor can pull on that sacrum. Now, if we turn the pelvis model this way, you can see all this muscle tissue here. This is pelvic floor, okay? Just like you have your glute muscles, you have your quads, your hamstrings, heck, even your bicep muscle. It's just muscle tissue, and it just happens to be located at the base of your pelvis here. So you can see it from this point of view, or you can look at it from the inside. And that is really important to know because a lot of people don't know where their pelvic floor is. They don't even know like what it does, or that you can even see or be able to assess it actually. So in pelvic floor assessment, muscle assessment, we actually check the muscles externally as well as an internal assessment because that tells us so much about what's going on in your pelvis here. Okay, so that was a little bit about pelvic floor anatomy. Now we're going to talk about the function of your pelvic floor. And so in the pelvic world, we like to say that it's the 5 S's. So the first S is support, and support means support of all of your pelvic organs. As you see here, there is no bone here, okay? There's bone here. This is your tailbone. Here's your pubic bone. Here are your sit bones. And your pelvic floor attaches here like a trampoline, kind of like a hammock, okay? And these muscles, they support your bladder, your bowel, and your reproductive organs here. Um, so super big role. And when your pelvic floor doesn't support your organs, that's when you see issues like leakage or pelvic organ prolapse. Now, the second S is stability, stability of your pelvis. And so you can see here that your pelvic floor is attaching to all these different pelvic bony landmarks here. And your glute muscles are also crossing between your hip, your femur, and your pelvis. And so your pelvic floor also helps in stability. And the issue that we often see is if your pelvic floor isn't offering the stability that your pelvis needs, that can cause a lot of pain and discomfort in this region. And sometimes it'll feel or appear like it's back pain or hip pain when it's actually coming from your pelvic floor. And what I like to tell people is if you've been doing like orthopedic PT, sports PT, any other sort of therapy or modality, and it's not quite helping, but maybe it's helping like 80%, but there's like a missing piece. I tell people that the missing puzzle piece could be your pelvic floor because you can't really see it, and it can be pulling on these muscles and on these joints, causing it to feel like hip and back pain. So that's the second S. The third S is sphincter control. So here you can see that we got the vaginal opening here, and then we have the rectal opening here, anus, and you have your urethra right here. And these are the three sphincters on a female pelvis. And these sphincters, they control urine, they control bowel movements, they even can control like when it comes to intercourse, like penetration, or even if you're having like a gynecological exam, or trying to use a tampon or a menstrual cup, things like that. So that is sphincter control. That means that it makes sure that you don't pee or poop your pants when you don't want to, and that you're able to empty when you do want to. Okay, what are we on? 1, 2, 3, 4. The fourth S is sump pump. All that means is that your pelvic floor muscles help pump blood and fluid, like lymphatic fluid, back up to your heart to get redistributed through your body. This is very important, especially postpartum or after an abdominal pelvic surgery, because you want that fluid recirculating and not just sitting. The last S is sexual health. So that means that it's really important for these muscles to be functioning to be able to tolerate intercourse and sex, and also to ensure that, if you do get pregnant, you are able to deliver your baby without any complications due to pelvic floor muscle issues. So that is about it for the teaching portion. So that'll just be, 10 minutes, 15 minutes whenever we do this. Now I'm going to get into answering these questions. So the first question was about leakage with coughing and random leakage. Is it because of the same thing, or are they two different things? So to really understand leakage, you have to understand that there's two major types of leakage. We classify it into stress leakage or urge leakage. Now, stress leakage is the kind that happens when you might cough, you might laugh, you might sneeze. I feel like my sneeze. And that can cause leakage. It could also be leakage with exercise. So like maybe you're jumping rope, maybe you're squatting or lifting something overhead and it causes leakage. Basically, it's any kind of leakage due to some external pressure or something happening in your body that causes your pelvic floor to not be able to do its job of sphincter support. So that's stress. And we'll get into in a second what are the suspects or culprits that might cause stress leakage. Urge leakage. So I'm not really sure what the random means. So random could mean, you bent down and had leakage. Random could be you were on the way to the bathroom and you leaked. Those are two different things. So stress would be anything with any movement leakage. Urge leakage, that would be anything where you are, let's say that you have to go to the bathroom and you start walking to the bathroom and then all of a sudden you pee yourself because you touched the doorknob or you saw the toilet. Urge leakage could also be, let's say you like turn on the faucet and then all of a sudden you feel like you have to pee, or you hear the sound of like rushing water and it makes you want to pee. Or you pull into your driveway and all of a sudden you're like, I have to pee. Those are urge. That's kind of like urge leakage cues, and it's urge leakage. That's urgency, but it becomes a leakage if you feel that urge and then you have leakage. So two different kinds of treatment. So that was the first question. Leakage with coughing or random leakage. It could be two different things, or it could be the same thing depending what the random is. So hopefully that answers that question. The next question was to see actual exercises to strengthen the pelvic floor when it comes to leakage. And this is a can of worms because leakage can be caused by multiple different factors, and the cause of someone's leakage is individual to them, and it could be one thing or it could be multiple things. So it's really hard to answer this question and give specific exercises just because it actually is different depending on the person. But I will share, who I broke it down to six suspects. We got to figure out who is the culprit here. So I'll break it down to 6 categories to help sort of narrow it down. So culprit number 1 is the pelvic floor. With the pelvic floor being a culprit, usually the first thought that a lot of our patients think is, okay, I'm leaking, so I need to strengthen my pelvic floor. So we'll get people that call us and they're like, I want to learn how to strengthen my pelvic floor because I'm peeing my pants. But what we'll do is that we'll do a pelvic floor assessment, and sometimes we find that their pelvic floor actually has a lot of tension in it. So to give an analogy, have you ever, a lot of people will struggle with like tightness in their hamstrings, or they'll have like tightness in their shoulders, and because of that tightness, it's causing an issue. And so just like those muscles elsewhere in the body, if the pelvic floor has tension, what happens to a tight muscle? So let's pretend this is the muscle here. If the muscle is too tight and it's like stuck, that means it can't do its job. In order to do its job, it must be able to move like this. But if your pelvic floor is tense, then it can't move, and it also can't prevent leakage from happening. So number 1 with the pelvic floor, we have to figure out if your pelvic floor is actually too tense or if it actually is too weak. And sometimes it can be both. And so a pelvic floor assessment will help you figure out which category your pelvic floor is in. Another issue that we see in the pelvic floor is a coordination issue. So maybe the pelvic floor finally, maybe it can move, maybe it's not very strong, but maybe it doesn't have good control. And so if it has to react really fast, let's say you sneeze and it was unexpected, your pelvic floor has to be able to just respond really fast. And if it can't do that, then it can't meet the demand of the sneeze, and it will lead to leakage. So that's culprit number 1. Culprit number 2 is your hip and your glutes. There was a study done I don't know what year. If you want me to look it up, I can find it for you. But there was a study done on women who they measured their hip strength and glute strength. And they found that the women that scored weaker or lower on the strength of their hip and their glutes actually had a higher incidence of experiencing leakage. And so your hip and your glutes having any like weakness or imbalance in these guys here can actually be a factor in having leakage. And and that's why it's really important to look outside of the pelvic floor when it comes to getting the right treatment that you need. So that's culprit number 2. Culprit number 3 is your abs, actually, your core. So we'll see sometimes, especially with postpartum mamas, they'll come in and they'll have a lot of tension in their abdominal muscles because, I mean, those muscles are working overtime for you. And something that we'll see is, so if you pretend that this balloon is your stomach area here, and this is the top of your core, this is your pelvic floor, and these are your abs. If my abs are tight and they're putting pressure down here, it can cause, if you look at what happens here, what happens? This goes down. When that goes down, that can lead to leakage and pressure. And so sometimes we'll find that people's abdominals have a lot of tension in them and weakness, and it can cause leakage that way too. So that was culprit number 3. Culprit number 4 is postural. So I'm going to use postpartum moms as an example because it's the easiest one to use right now. But, you know, what happens in pregnancy? So women start to move this down. Your belly is growing, so all of a sudden you start coming forward, so you get a little bit of that curve in the low back. We'll also see what happens here when you're pregnant. Your ribs start to flare like this, and your back starts to round because your boobs are getting bigger, and your center of gravity is moving forward. And what happens there is your posture has changed, and the system is no longer equal, and that can cause leakage because the system's made to be dynamic and to move, but when you stay in a certain posture that it wasn't meant to be in long term, it can cause some issues with your pelvic floor too. And a lot of times we'll see mamas come in and they're still walking, they're postpartum, but they're still walking like they're pregnant. So that's another biggie. Pressure. So this is culprit number, what are we on? 1, 2, 3, 4, 5. Culprit number 5 is pressure. And so bringing the balloon back. With pressure, what you'll find is it's the same idea of there's not an equal distribution. So when your posture is off, there's not an equal distribution of forces. And when the force is not equally distributed, it will go down. So same thing with pressure. If it's not equally distributed, I don't know why that word sounds weird to me right now. Your pressure can go down, and that can lead to leakage as well. So one common example that we see often is people holding their breath, and that's a super easy fix. So sometimes people will hold their breath, and if this is me holding my breath, what happens? See that downward movement here? That downward movement causes leakage. So that's culprit number 5. Okay, culprit number 6. This culprit is due to urge leakage we talked about earlier, where your brain and your bladder, there's like a miscommunication. So your bladder is telling you, hey, gotta go to the bathroom, whether you actually do or not. Your brain is getting that message up here, and your brain is like panicking, freaks out, and then it tries to get you there, but because it's panicking, it can't get you there fast enough, and then your bladder decides to squeeze, and then you have leakage. So having to restore that brain bladder connection will solve that problem. But those are the 6 culprits of what can cause leakage, and that is why it's really hard to give an actual exercise because, um, I mean, you can Google all day pelvic floor exercises for leakage, and it'll just give you like Kegels and core stuff. But if that is that really what your body needs, it may be, but it may not be. So it's hard to answer that question, and I can always dive deeper into that um, if you have any follow-up questions about that. Okay, so we're gonna switch gears for the last 2 questions. Okay, question number 3, second to last one, is asking about what are some ways to release the pelvic floor at home. And the reason why I went through a little bit of a 101 before answering this question is because I needed you guys to understand that pelvic floor strengthening is not always the answer. Sometimes your pelvic floor is too tense and it's causing your symptoms. Those symptoms could be leakage, pressure, back pain, hip pain, pelvic pain, constipation, all those things, even diastasis can be made worse due to having a tense pelvic floor. And so this is why this question came up, is because what are some ways you can stretch or release the pelvic floor at home to address those kinds of issues? Obviously, if your pelvic floor doesn't have any tension, then doing a pelvic floor release might not do you any good. But if your pelvic floor does have some tension, which honestly, like 90 to 95% of our patients have pelvic floor tension, then this could be helpful for you. So something that we always prescribe for home for our patients is to do different stretches. So the stretches such as like happy baby, a deep squat, diaphragm breathing, those things will directly impact and help release your pelvic floor. We have some posts on Instagram that demonstrate those exercises, which I can find and post in the comments below. The other thing that we teach our patients how to use to release their pelvic floor at home is dilators and pelvic wands. So in the office, we do manual internal therapy, and so we will do the release and we'll teach you how to use the tools for that release. But if you're trying to do it at home, these are the tools that we recommend. We have dilators, so this is the smallest one we have, and this is the biggest one that we have. And so this is really good for people that have vaginismus or like globally a tense, overactive pelvic floor muscle. And these are just inserted into the vaginal opening, and we give people like a more specific protocol depending on how severe their symptoms are, whether they just like insert and leave it and rest, or maybe add some movement to it too. So these are vaginal dilators for that, and they come in all sorts of sizes. So these are the larger set size, and then this is like the smaller set. So a lot of people that are struggling with like pain with intercourse, we might have them start with the smallest that they can tolerate, and then slowly like work their way up to a bigger size depending on the size of their partner, or if they're wanting to use any other sort of device. Now, my personal favorite is a pelvic wand. The reason why is because it's curved, and your pelvis, is it straight or is it curved? It's curved. And so the wand actually helps you to target muscles that are a little deeper and release them. And you know, everybody presents differently, so some people it might be their left side, other people it might be their right side, other people it could be everywhere. So knowing your body and what you need is very important when it comes to using these medical devices, and making sure you're using it correctly, which these are from Intimate Rose. Love that brand, but I think it does come with like some instructional videos too on how to use. My biggest precaution is if you're using this, like you definitely need to use a lubricant with it, but you do not want to use a silicone lube because that will degrade the silicone material of the devices. So you want to use like a water-based, preferably. And I've had some patients use like coconut oil. So those are some good options. That's how you can release your pelvic floor at home. Okay, last question is pressure or unaware of bearing down. Um, so this question, uh, it can, how do I say this? Kind of how I went on my big spiel about leakage and how there's like 6 different potential culprits, and it could be multiple culprits. Like, who's the suspect here? You know, we got to figure it out. Same thing with pressure. So, a lot of women will complain of like vaginal or rectal pressure postpartum, but also we've had patients come in who haven't had any kids, or even male patients who've come in with the same complaints. And so, pressure could either be due to pelvic floor tension or pelvic floor weakness, or it could be both. Um, and just like the same culprits we had before, pelvic floor, hip and glutes, abdominal muscles, postural um, pressure, like those things can cause the sensation of pressure vaginally and rectally as well. Um, so it's hard to say